That is Justin Bieber and Dr. Rochelle Walensky. That may be the first time you've probably been on hold listening to a remix of Justin Bieber from the CDC headquarters.
You guys look like you're having an awful lot of fun. I can tell you that.
I mean, listen, some people choose a path like yours. Others choose this path. Right? We all make choices. We all make choices. But the CDC in my hometown of Atlanta, so it's great to have you with us. We appreciate you coming on. My gosh, are you busy?
It's been busy. It's been busy.
But there's a lot to cover. We're going to talk about people who are not vaccinated and your push to get them vaccinated. But first off, just out of the gate, just to ask you a couple things. The new variant. We're vaccinated. So those of us who are vaccinated, what do we need to be thinking about with this new variant?
Well, so first thing to know is we always worry about variants because they demonstrate that the virus is mutated. And when the virus is mutated, it usually does so with some advantage to the virus. So this time, the Delta variant that everybody's been hearing about, that advantage is that it's more transmissible. Wow. And so we know now that about 57% of all virus here in the United States is the Delta variant. But the good news is that our vaccines work against it. And so the really important thing to know is that if you are not vaccinated, you are at higher risk of getting the Delta variant, and you need to put on your mask and you need to do all those prevention measures we've been talking about for over a year now. But if you are vaccinated, you're really well protected even against the Delta variant. Now, what we worry about with variants in general is that they will continue to emerge as more and more virus circulates, and that one day they might emerge to evade our vaccines. And that's, of course, the biggest concern, which is why we want to suppress virus all over the place.
So the evolution of a variant is something that's going to be in our near future, for sure, then.
It's like I worry, indeed, here in the United States and around the world.
And what about this fall? Are you concerned about what's going to happen this fall? I wouldn't say we haven't let our guards down, but we have in a way. Once we were vaccinated, we feel like we couldn't do anything. Our superpowers are back.
Mm-hmm. Right. I went to Dodger Stadium with no mask. So
I went to Vegas.
Right. So, viruses tend to be happier in the fall and winter when we're indoors, when it's cooler, when there's less humidity in the air. They tend to be happier and tend to infect us more. We see that in all of our upper respiratory infections. Mm-hmm. So summer tends to be the best time for us to try and rid ourselves of this virus. What we worry about now is we're actually seeing cases increase during the summer months. Yeah. And of course, what we're seeing truly is that the cases are increasing in areas where we have low vaccination rates. So in areas with higher vaccination rates and in people who are vaccinated, we're not seeing that surge, those individual cases, those community cases, those family cases. And so what we're really trying to do is use this time in the summer to get people vaccinated.
Will we need a booster shot?
The famous question. We don't know yet. What I can tell you is we're watching this super carefully. So we are looking at data from the clinical trials, we're looking at data from the laboratory, and we're looking at data from our cohort studies over time. And we've been following this really since people have been fully vaccinated in January. And what we know right now is that we have 3 really safe, really effective vaccines that work against the circulating variants that we have here in the United States. And as we follow these data, and we're doing it, weekly, as we follow these data and get updates, we will let the American people know if and when boosters are necessary. And the important thing is we're preparing for them. So when we see science that indicates we will need boosters, we will be ready. We haven't seen that science yet.
Okay, Dr. Rochelle Walensky with us. Now, let's speak to those who are not vaccinated. Just 2 thoughts going into this, because I solicited for listeners to write into us why they're not. One of the responses was they heard rumors that only 50% of the doctors at the CDC are vaccinated. Is that true or false?
So that's a really good question. I would venture we don't keep records on that, so we don't have any way of knowing. So I would want to be completely honest to say that if we had those statistics, I would give them to you. We don't keep records on that here at the CDC. What I can tell you is if you look at doctors nationwide, the vast majority of them are vaccinated. There are many, many hospitals that are requiring vaccination across this country. And so our healthcare workers, in a general sense, I can't give you the proper stats, but on a general sense, are vaccinated. They are treating patients. They are caring for themselves and their families. And so they, in fact, are vaccinated.
And then another listener of ours, listening right now, said, without the long-term studies, bypassing animal trials, et cetera, how do you guarantee the safety? I think you've heard that question before, but what's your response?
We have now vaccinated we have deployed vaccine in over 300 million people since the end of December. That's an extraordinary track record. And we have found when we track these things and we're following them in many different safety and surveillance mechanisms, we let the public know as soon as we know anything. Our track record for the safety of these since December is truly extraordinary. And our track record for the effectiveness of these vaccines is truly extraordinary. And I think far beyond what we thought we would see in effectiveness in the initial trials. I think we all celebrated last year when we saw over 90% effectiveness from these vaccines. So over 300 million people doses given, over 150 million adults have been vaccinated in the last 6 or 7 months. And we report the safety signals to you as soon as we know them. And what I would say is they're extraordinarily safe and they're extraordinarily infected. And what a gift that has been, what a scientific miracle that has been given where we are in this pandemic.
And before we let you go, what can you tell us about younger people, kids that will need to be vaccinated or not?
The first thing I'll tell you is that I have some younger kids and they were some of the first in line to get this vaccine. I think our kids, our teens, they want to get their lives back. They want to be safe back in school. They want to be able to socialize in ways they've already missed out on so many opportunities and so many milestones in their teenage years. We have this vaccine now available for 12 to 18-year-olds, for anyone over the age of 12. It is free and it is safe for this cohort of people. And my kids were among the first in line. And I would say this is a way to keep you safe, keep your family safe, your parents safe, your grandparents safe, and to actually regain control of your life so that you are not at risk of this disease.
What about if you're a parent not vaccinated, can you endanger your own kids?
Certainly, anybody who is not vaccinated is at risk of getting disease and at risk of transmitting disease to anybody around them, which is really why we say, kids visiting your grandparents, even if you don't get symptoms, senior people who are not vaccinated, you could put them at risk. So really, we are trying to do this family by family and community by community. And what I would say is, I'm not here to convince you to get vaccinated. I'm here to say, you may need more information. If you need more information about getting vaccinated, what are your questions? And let's help you answer them. Because I think if you hear all of the information out there, you'd make the same decision that I have, and that is to get vaccinated.
All right. Well, thank you very much for the hours and hours you're putting in there to keep us healthy and moving as a country. Dr. Rochelle Walensky, appreciate you coming on. You can find a COVID-19 vaccine near you at vaccines.gov. There was an official plug for you there. That's good. It's like normally I'm saying in theaters now, but this is you're not in theaters, but you can go to vaccines.gov. Hey, thanks for coming on. Great to see you.
Thank you so much.
Take good care. Bye-bye.
Bye.